Welcome back to the Morning Blend. Hand injuries are very common. In fact, 1/3 of all acute injuries seen in the emergency room involve the upper extremities.
Yet now all medical centers have hand surgeons on call, and a hand injury that is not treated properly can alter a patient's mobility and return to complete function. So here to tell us about the 24/7 specially trained team at Aurora Health Care is Dr. David Clark. Welcome to the Morning Blend.
Thank you for having me.
Great to meet you.
You know, Molly often tells her story, and you may again, but I think it's a really important thing to have somebody who's specialized in hand and upper extremities on call at a hospital. And this is something that you guys do specifically through Aurora Orthopedics, right?
It is. So we have an Aurora Orthopedic Hand Service, which is something that we've developed in the last year. It's allowing patients to have a fellowship-trained hand surgeon on call 24/7.
And Tiff brought up, because I was in a car accident in college and I went to an emergency room, but I'd severed a tendon in my hand, and we later saw a hand surgeon who repaired it, and I have full mobility. But it's a very specialized thing, and if you don't get the right kind of care with something like that, it can affect you for the rest of your life.
It's interesting that you bring that up, because that's exactly what we're here for, is that kind of injury. While we have subspecialists in orthopedics that take care of other injuries and problems like joint replacements, the hand is a different area that we subspecialize in. So we oftentimes will see patients coming in through the emergency department with an injury like what you had, and they need to have a surgery that allows for increased mobility and use of the hand.
And it's not just hand, it's hand, elbow, shoulder, it's kind of that whole upper extremity, right? What is your protocol? Why is that kind of different, you know, or how does it benefit a patient?
Well, it is the entire upper extremity, and we specialize in that area, and that's because we know that subspecialty care will get patients the best care. And that's really how all of orthopedics is designed within Aurora, that we try to get patients matched up with the individuals doing the surgery most frequently and seeing those issues. So we know that the surgeons who take care of those issues are going to do the best job for the patients.
And how do you work together then? Because it's a team approach, right?
So these things are coordinated through our call centers and our different clinics, and the people organizing and triaging these calls will say, well, we're going to get this individual to see this practitioner because they do that the most frequently.
So do you go to multiple hospitals on call?
There are multiple hospitals that we cover on call, and there are multiple sites that we cover as far as clinics. So the clinics can range from West Bend down to Racine, and that's ever expanding. We're moving that out to different areas as well.
Is it possible that you could be called for an opinion outside of Aurora's locations?
That's something we frequently do. So oftentimes we'll have patients contact us for a second opinion, or we'll have somebody contact through what's called the tertiary access program, and they'll get in touch with a facility such as St. Luke's Medical Center or the Grafton Medical Center and be able to see one of our hand surgeons and give them some advice.
What's the goal when somebody comes in? Is it what Molly said, is that you have full mobility and you don't lose any of that function in your extremities?
I think our goals are primarily to get patients to going back to using their hands. So most of the time patients just kind of take for granted their hand. It's really the way that patients interact with the world around them. And oftentimes patients just kind of take that for granted. We want people to get back to doing those things and not having to worry about their hands.
How do you see it benefiting someone who's in a trauma of some sort to have an expert's opinion?
Well, I think that when you see somebody who's taking care of something every day, they're going to do the best job for those individuals. The daunting task is for somebody doing sort of community orthopedics, and they're most of the time spending their time on knees or hips, and then they have an hand injury. Maybe they're going to feel overwhelmed with something they're not used to seeing. That's what we're here for.
I know the holidays can sometimes bring up little accidents with your fingers or things. This is just a random question, but you know, a lot of people, you know, sort of like slice off the tip of their finger. Is it true that you're supposed to put it in milk or ice? If you do that?
It's always okay to bring it back. It doesn't always mean we're going to be able to put it back on. We try to do that for patients. We wouldn't put it in milk.
Okay, I don't know why I heard that.
That's a tooth.
Did you hear that? Oh,
that's a tooth.
It's a tooth.
You
Put your finger on ice.
You can put your finger on ice, wash your hand, and go to the emergency department. Yeah.
I haven't gotten a lot of sleep this week, Doctor. So putting it together.
It's a good reminder,
Yeah,
because if something like that happens to you, it's good to, in the back of your mind,
find it, right?
Put your finger in ice.
Look on the ground.
That's good.
Bring it in. Hopefully we can help you out.
It's great to meet
See
you.
a specialist.
Yeah, thank you.
Thank you so much. And here's the information, because if you're looking even for a second opinion on a hand, elbow, shoulder, or another orthopedic issue, you can call this number toll free at Aurora. It's 1-888-649-6892, or go to aurora.org/ortho. Thank you again
Thanks,
for your
Doctor.
time. We
Thank you.
appreciate it.